I'm here at St. Mark's Hospital so that you can talk to some of the frontline healthcare workers who are dealing with COVID in our Milford community, including my daughter Jill, who works in the COVID floor at St. Mark's.
I've been working on our coronavirus unit since we opened it. I'm pleading with our community, please do everything that you can to try to slow the spread of this virus. It has been emotionally exhausting for everyone working on the coronavirus unit. Seeing people alone in their rooms for days to weeks on end, some of them dying alone or with just a nurse or a respiratory therapist with them at the end.
We're seeing a lot of really sick COVID patients. We take care of the sickest of the sick here. We end up treating these patients like family because they're not able to have visitors because of their illness.
It's a lonely time in a hospital. Patients have limited visitors. They're relying on our care providers to be family.
Our patients are lonely and they're sad and they're missing their families and it's hard.
The nurses kind of take on that family role for them, and we end up getting really close to these patients. And unfortunately, we've had some that have passed from COVID. We've gotten so attached to these patients and so attached to these families that it becomes a loss for us.
As a hospital, we have come up with so many new measures like screening and checking patients' temperatures before they walk in to make sure that everyone is safe. These are things we haven't really done before because we haven't lived in this reality.
If you are sick, don't put off your health care with anything, not just COVID. What I'm seeing is my patients are very, very sick, and I think people are waiting too long to come and seek medical attention. So if you feel like you need to come to the emergency room, please come. Don't feel scared.
We have put so many measures in place to continue taking care of our patients. We want the patients to know that this is a safe space. We want them to know that they're in the hands of terrific employees.
I think the biggest thing we can be doing as a community is wearing our masks, washing our hands, social distancing. We've also seen a big rise in suicide and depression rates, so I think it's really important to be checking in on your loved ones. Even if it's just a phone call, make sure your people are doing okay.